So this is my second video. As I already told you, the second video will be about the types of hypertension in which the RAAS mechanism is involved. So let me first enumerate. So there is 1 kidney gallbladder hypertension, 2 kidney gallbladder hypertension, hypertension due to the diseased kidneys that secrete renin chronically, hypertension in pregnancy, that is eclampsia or preeclampsia, neurogenic hypertension. So you just remember two things, okay? So the mechanism of for renin secretion: decrease in BP and sodium chloride delivery. So if sodium chloride delivery is less in the DCT, renin will be more. There is inverse relation. Just remember these two things. These two things are very important. Now the 1 kidney gallbladder hypertension and 2 kidney gallbladder hypertension. So these is aorta and these are 2 renal arteries. So in the 2 kidney hypertension, the one artery is normal but the other one is constricted. So the constricted renal vein, what will it cause? It will actually, what happens there, BP increases and sodium chloride delivery decreases. So these two stimulates renin secretion. So renin increases. Now the renin increases, that will cause increase in angiotensin 2 and that will cause increase in BP. The mechanism you already know, as I told you in the previous video. So now you may think there is decrease in blood supply. How will it actually increase our sodium water absorption? So there may be blood supply is less, but the other arteries are normal, okay? So actually it is constricted, but at least there is some blood flow. So the same kidney will also absorb some salt and water, and the other kidney will absorb more salt and water. And in the 1 kidney gallbladder hypertension, there is no other kidney, but the one is constricted. So the constricted one will actually, the mechanism is unsettled. Mechanism is unsettled. So there is a renin can be normal or even low, but these respond to ACE and losartan. That is important. Okay. Now the hypertension caused by diseased kidneys that secrete renin chronically, it is just like the gallbladder hypertension, but here there are some infarct areas and some normal areas. So like a normal and diseased lies in the same kidney. So infarct areas, there is vasoconstriction, just like the constricted artery was there in the kidney. So same mechanism here, BP decreases, sodium chloride decreases, that will, the infarct area will secrete renin. The renin will stimulate normal area to increase or absorb more sodium and water. Now the hypertension in upper part of the body caused by coarctation of aorta. So what is coarctation of aorta? This is common carotid artery. This is subclavian artery. Next to the subclavian artery, there is some constriction. So if there is constriction, there will be less blood. So there is actually hypertension in the lower body, but there is normal BP in the upper body. Now what happens is, since renal artery there is low BP, it will stimulate renin and angiotensin mechanism. This mechanism will increase more sodium and water, that will cause normal BP in the lower body but higher BP in the upper body. Okay. So actually collateral also develop there. So collaterals and coarctation both cause vascular resistance, that will increase BP in the upper body due to the renin. Okay. But in the long run, it actually auto-regulation in the upper body causes normalization of blood pressure. If not, we can give drugs also. Hypertension in pregnancy, toxemia of pregnancy basically. So there are two terms, preeclampsia and eclampsia. So what's the difference? Preeclampsia is hypertension plus proteinuria, and eclampsia is hypertension plus proteinuria plus seizures. Seizures happens in the later part of pregnancy. It is a major cause of abortion. Epidemiology of this hypertension is 5 to 10% expectant mothers. So the mechanism behind this is placenta ischemia causes release of toxic factors which causes hypertension. Now the mechanism of these toxic factors to cause hypertension is substances released by the placenta cause endothelial dysfunction including the kidney. So there is endothelial dysfunction. Now you all know, or maybe you don't know. So endothelium releases nitric oxide, that is a vasodilator. So since there is dysfunction, so nitric oxide and other vasodilator also decreases. Now there is vasoconstriction. Vasoconstriction cause, decrease BP, decrease sodium chloride, that will increase renin. And vasoconstriction also called decrease natriuresis. So all these mechanisms cause increase in BP. Now there is autoimmunity also involved. Thickening of glomerular membranes happens, which cause decreased fluid filtration, that will cause decreased sodium and water excretion. Now the neurogenic hypertension, strong sympathetic stimulation if happens due to any reason, that will stimulate the beta 1 on JD cells. As you remember that there are beta 1 on JD cells, that stimulation of which causes activation of renin, angiotensin, aldosterone mechanism. So that will increase renin. If renin increases, you all know what happens. Exercise anxiety stimulate beta 1, and there can be acute hypertension. Now the acute hypertension caused by sectioning of baroreceptors nerves can also happen, and just like neurogenic.